everyone. All right, I'm comfy on my couch this morning for this live Q&A. I want to remind you that none of this is medical advice. So all of this right now this morning is just educational answers to all of your vestibular questions that you've asked me this week. So I am going to get started with just a couple of questions that you guys have asked. As always, you can ask me more questions in the comments section, and I will scroll up when I get to the end of these questions here. I have grouped them mostly by like general groups of questions people tend to ask. But if you have a question more specifically for me, I again cannot give you medical advice. You should not take medical advice from someone over the internet. And you should always ask your doctor. Okay. So can everyone hear me okay? Give me like a thumbs up or something like that. I just want to make sure that the audio is okay. All right, I'm going to assume that it is. If you can hear my fridge, I apologize. It is loud. Okay, so let's get started. Someone wanted to first know about if it's normal to have difficulty with brain fog, thank you, and tedious tasks. So yes, it is normal to have brain fog with a vestibular disorder. So vestibular disorders cause so many other symptoms besides just dizziness, lightheadedness, imbalance, because if your brain is working so hard all day to just keep you upright, like think about it, your vestibular system's job is to keep your head on top of your body and standing up. And if your brain is working so hard all day, every day, just to keep you upright, then everything else kind of goes out the window. Your whole body's job, that the function of everything, is just to keep your brain alive. That is your body's whole function. So if that standing up and being vertical or walking around all of a sudden becomes a really difficult task because your vestibular system is struggling to balance, then you might also have some brain fog, some other symptoms, and therefore difficulty with tedious tasks. Specifically, this person asked about like typing, writing, reading, and doing like fine motor skill kind of tasks. So yes, because your brain is working so hard just to keep you upright, feeling balanced, and trying not to let you feel dizzy all day, that can be really triggering for other things such as brain fog. And as your vestibular system gets stronger with vestibular therapy, different medications, cognitive behavioral therapy, things like that, as all of those systems start to adjust, the brain fog does tend to go away. Sometimes not completely. Sometimes people need things like Cognimag. Other forms of magnesium do tend to help, but as always, ask your doctor. So the next question I got was, are there exercises specifically for the floating in bed feeling? So the floating in bed feeling is a tough one because it's when you're most still at night. You're not on a really firm surface. I'm not going to ask you to sleep on the floor where it's like most firm. But there are things that I recommend in vestibular rehab for people who have that floating feeling at night. Some people truly have like an out-of-body experience, and that's something that you should talk to, of course, your doctor about. But if you're looking for a technique in bed at night, you can start with either progressive muscle relaxation, which is where you tense a muscle and then relax it, or you can do grounding. So think about like each part of your body. Start with your heels and then like work your way up your body till you get to the back of your head and be like, I am still, I am not moving, my body is in place. And that does tend to help a little bit. Sometimes people get like the floating feeling so bad that I have them get up, go to the mirror, stare at themselves, be like, you are not moving, you are still, feel the floor, and then go back to bed and try again. Someone asked about internal trembling. This is someone I think is most frustrated about the internal trembling because they're not sure if it's talked about by other people. I do hear this symptom a lot. I don't exactly know what it is. I would assume it's sort of like a chronic motion feeling. I've had some patients who have reported it. It's oftentimes with attacks that it happens, but not always. Some people have it chronically or just at random during the day. Ask your vestibular therapist for a recommendation about how to treat this, or your doctor. You should always tell all of your doctors about anything that's changed or is new, but it is a symptom that's common. And I would say that just as your treatment goes on, it does also tend to go away. Can you exercise with a migraine attack? So let's just talk about regular exercise, like not vestibular exercises specifically, but just like we did in group fit this morning. We had arms day. It was great. We got moving. We did lots of upper body stuff. We did some balance challenges. It was great. Can you do that sort of a thing with a migraine attack? Yes, it's possible. You totally can do any of those things. Sometimes it actually makes people feel a lot better. On the very first one of these Q&As, I talked to Julie Wilkins. You can go back and watch that. It's on my feed on the IGTV. But so for her, when she gets an attack, she actually intentionally, once she feels like she can kind of walk around, even though she's not feeling 100% yet, she actually goes and walks out in her garden, like does head turns and tries to get some movement in, and it does really tend to help. At least 30 minutes of exercise a day is really recommended for people who have trouble with like for people with migraine. God, I just lost my train of thought. I'm so sorry. So for most people, I would say, yes, absolutely, you can 100% exercise with a migraine attack. It might actually make you feel better. But again, that's very, very person dependent. Okay. Next question that I got was, how long do I live with brain fog and with vestibular dysfunction? So this is a really difficult question because it's really different for everyone. Recovery from a vestibular disorder is not an overnight kind of a thing that will happen. It is a chronic illness. There is no cure for chronic illnesses usually. So especially vestibular disorders where there isn't really an end to them, but there are things that you can do to treat them. And that's sort of what we do in vestibular therapy, in group fit, in just all aspects of everything. So if you have a vestibular disorder and you want to try and make it better, there are things you can do. There are treatments. You should have regular therapy, physical therapy, a neurologist or a neuro-otologist, an ENT. There are so many providers who can help you. And I think that it's really important that you address an entire range of providers in order to try and get the best form of treatment for you. This is because every provider has a different take on things, different way that they can help you. So that is part one of that. Part two is how long do I live with this? The answer, unfortunately, is forever, because there is no cure, but there are ways to manage it, which goes back to my thing about having a whole host of providers who can help you manage and treat all of your symptoms. And I would definitely recommend a vestibular therapist. I might be at least a little bit biased, but it is really, really helpful. I've been seeing so many patients with this, or with all vestibular disorders all over telehealth. It's been going really well. People have been doing great and really improving. If you're watching this and you're a patient, shout out to you. Someone right now is asking how to exercise with MDDs. So you can exercise with any form of vestibular disorder. If it's vestibular migraine, vestibular neuritis, MDDs, 3PD, it is recommended that you exercise with it. So the answer of how to exercise with it is start with walking, start with group fit, start with anything that works for you. And because exercise and vestibular therapy isn't the gold standard of treatment for MDDs, it's not necessarily going to treat it like it could for other things. But if you have underlying vestibular migraine, it can help treat that, which will help with the MDDs. MDDs, for those who don't know, is mild debarkment syndrome, and that basically means that if it happens typically after. It can spontaneously happen, but typically it happens after you were on a chronic passive motion trip. So usually if you were on a really long car ride, if you're on a boat ride, a plane ride, something like that, you get off and you have like that couple minutes of having sea legs, and then you have like that rocking feeling. You might have experienced this before. That doesn't go away. So that's MDDs. The gold standard of treatment for MDDs is the DIE protocol, most commonly found at Mount Sinai in New York City, but there are other places. I know there's a place at least in Belgium who does it, and I'm sure other places in the world, in the US, that do this. You just have to kind of ask around and see who can help you with it. It's like optokinetic stripes going one way and passive head motion like this at the same time to a very specific beat. Your physician, your PT have to help you with it. But you can exercise with MDDs any way you please. Have I ever seen someone fully recover from vestibular neuritis? Absolutely. So vestibular neuritis is a viral infection in your inner ear, and it infects basically your vestibular nerve or your vestibulocochlear nerve. Then it's labyrinthitis if it's also with hearing loss, and it just decreases the amount of function that nerve has. So both of your vestibular nerves all the time should be firing like this, saying, I'm looking forward, I'm looking forward. When you look to the right, this one fires more, this one fires less, and vice versa. So all day long, that vestibular nerve is giving you a signal about where you are in space. When you have a neuritis, you get a decrease in function. So let's say in this case, my right side has that hypofunction, so decreased function, then my brain thinks that I'm looking to the left all the time, even though I'm clearly not. So there are a bunch of ways that you can diagnose this: VNGs, head thrust tests, head shaking nystagmus tests, lots of different stuff. But your brain basically needs to relearn that this is your new normal. As human beings, we do not regrow nerves. We're just not good at it. We don't do it. Like, we're not like starfish. You can't like regrow an arm, right? We just don't regrow stuff except for like hair and skin. So if your nerve is now like this, you just have to retrain your brain that this is your new normal. So yes, it does recover. It does go really well if you get the right treatment. Without physical therapy, I've seen people like come in for a consult, be like, I'm really dizzy. I'm like, you probably have a neuritis. Here are some exercises to do. And literally the next week they're fine. There are other people where this is not the case. Sometimes there was more of a dysfunction. Some people get a lot of anxiety with this. And if you have a lot of anxiety, which is not your fault and you're not causing this, but that cycle starts to happen, and then like the dizziness causes anxiety, anxiety causes dizziness, and it just continues to go in a circle and a circle and a circle. And that can really be uncomfortable, and that can prolong the recovery of neuritis, but it doesn't necessarily mean that you're not going to get better. So yes, people do fully recover from neuritis through positive neuroplasticity, usually with vestibular rehab. So does VRT fix the weakness or recover totally? So this kind of goes back to what I was just talking about with vestibular rehab. So VRT fixes the weakness through neuroplasticity. So again, if you have a hypofunction, let's use this example again. If you have this hypofunction, your nerve is not going to regrow or heal itself, but your brain does learn that this is a new normal for you. So when you move your head back and forth, your eyes will stay still. That's why VOR exercises are so important. That's why VOR cancellation exercises are so important. All of these things are really, really important to your recovery because your brain needs to relearn its new normal. Our brain can learn anything, you just have to teach it the right way, which is why it's important that you have a vestibular specialist or specialists, plural, on your team. Do vestibular issues impact eyesight? So this is a little bit of a loaded question because it feels like it impacts your eyesight, but it doesn't like do something to your optic nerve typically. So migraine, that is like a whole different subject, obviously. Like I talk a lot about vestibular migraine, so let's not talk about like ocular migraine or anything, or auras or anything like that. Let's just talk about purely does this vestibular system impact your eye directly? So your vestibular system's job is to keep your eyes still. So you can try this with me right now. You find a spot in the distance or use your thumb like I'm going to and stare at your thumbnail. Everyone ready? So you've got your thumbnail in front of you right here, and then you're gonna move your head, we'll do it slowly, right and left. So if you're doing this and your thumb stays still, that means your vestibular ocular reflex, or VOR, is working, and that is the job of your vestibular system. So your horizontal canal in this case, because we're in this plane, so horizontal canal like this, that canal is telling your brain to move your eyes in an equal and opposite direction each time you move. So if your vestibular system isn't working at 100%, it can make things look like they're moving. So that's why when you turn your head, sometimes things feel like they lag, or when you're walking, the horizon might look like it's bouncing, things like that, because your VOR isn't stabilizing your eyesight. And that's why it can oftentimes feel like it's impacting your vision. So I have a lot of people who are like, everything's blurry, but I went to the optometrist, the ophthalmologist, and my vision is fine. I can't figure out why. Usually a couple weeks of vestibular rehab, just shaking your head back and forth, keeping your eyes still at a very specific rate that is scaled to your needs is really, really helpful for that. And all of those things are, of course, helpful. So one more question, I think, and then put all of your questions in the comments because I'll answer them, but I don't have that many more questions at the moment. Someone wanted to know about the vaccine. This is, of course, a loaded question. I am not here to have like a political conversation with any of you. I have, however, seen different things in different people. I've seen people with COVID who got dizziness afterwards. I've seen people who got the vaccine who were mildly dizzy afterwards, either with or without a underlying vestibular disorder. I think it's really, really important here to note that every single person so far that I've seen who has gotten a vaccine that I have seen in clinic, regardless of history of dizziness, I've seen both, have felt back to baseline and or back to normal. So that is all I'm going to say about that. If you have more questions about it, ask your doctor. This is not medical advice. I'm just answering the questions as they're asked to me. Everyone who I've seen has gotten better. Someone asked me, after surgery, I've been told it will be November before the brain reaches adjustment to the new norm, having therapy and continue when needed. Should I reassess in November? So you should just chronically, I tell my patients, of course you're not my patient, but just always reassessing kind of where you're at with your doctor. There are objective measures you can ask your therapist. Everyone's timeline is different. I don't know what kind of surgery you had, but everyone's timeline is different. It's really important that you kind of look at your objective measures, see where you were before surgery, after surgery, all of those things. I hope that helps. On average, how long did it take the people that you saw to feel better or back to normal after they got the vaccine? So usually a couple of days. It was not out of the norm of a normal attack, or probably less. It's different for everyone. I know there have been a couple of people, I don't have a vestibular disorder, but I know that there are a couple of people with vestibular disorders, like Rooted Behavioral Education at the Dizzy Cook. Those two people have done blog posts and Instagram posts, like updating afterwards, and they've done really, really well with it. So you can go look at their accounts and see what they say. But they have done really well. I've been advised an MRI for my vertigo. Is it important to get one? So it's always up to you and your healthcare team. I cannot advise you if you specifically should get an MRI. Anything that's new or changing when it comes to dizziness and vertigo, typically there's imaging involved. So it's completely up to your providers. How will you know that the best VOR exercises are? I've been giving so many exercises by different people and told different speeds. Nothing seems to be helping. Is there a baseline starting point? So VOR exercises need to specifically be scaled to you. You know that you need a new plan. If someone is like, here, this is my pamphlet, I give it to everyone, and that is the exercises you should do. There are ones that you lay on your side, back and forth, back and forth, back and forth. Those are not usually the best standard of care. There are ones where you lay in bed and you move your head this way and this way. Not the best form of care. The best form of care is when someone sits down with you, probably for an hour at least, and goes, okay, what are you struggling with? What are the functional activities that are hard for you? We're going to test your balance. We're going to test your dynamic visual acuity. I'm going to look on a metronome, and I'm going to ask you to shake your head while you do this exercise. I have a worksheet usually that I use for people with a pineapple on it that I got from my internship at 360 Balance in Texas. I still use it to this day. It's great. There are so many things you can do with that, and then you should feel dizzy when you're done, but you should barely be pushing into that signal. That's my go-to. And for you, it might be different. That's the thing, is I don't know you. Unfortunately, you're not my patient. If someone needs help, you can always give me a call or email me. If you're in the States, I'm licensed and I'm happy to help you out. Because I'm not your therapist, I can't specifically tell you, but there is no baseline starting point. The baseline starting point is what is difficult for you. It goes back to, if you were going to go to the gym and you couldn't curl like this, like 5 pounds, and you're like, I would really like to be able to curl 15 pounds. Okay, great, but you're not going to be able to do that tomorrow, but the person next to you also might not be at your level. They might already be curling 15 pounds. So it's important that you go back to your baseline. You're going to curl 5 pounds, then 6, then 7, then 8, and it might jump at different percents than that. That's fine, but it's important that you know what your baseline is and slowly work up incrementally from that. The maximum is 120 beats per minute or 240, depending on how you count beats. If it's 240, then each beat is left, right, left, right. If it's 120, you have to go to the right on each beat. It's you can test on a metronome. That's where the dynamic visual acuity is tested at. You can find the DVA test somewhere in my reels, or you can Google it and do it with your doctor. Is MDDs and VM permanent or chronic? So VM is a chronic condition. MDDs can be treated and cured with the DIE protocol, but it is dependent on you and your symptoms, how long it's lasted, when, all those things. VM, on the other hand, is a chronic condition. There is no cure. There are just treatments in order to manage it. It is manageable. You just have to figure out what works for you. So people tend to track their symptoms, track their food, track the weather. I put a weather tracker up on Instagram last week that AccuWeather has specifically for migraine and pressure. Yes, they are chronic. Vestibular conditions are chronic. They are treatable and manageable when they are accurately managed. Would you recommend treating the anxiety first before doing VRT? I would recommend doing them at the same time. I tend to want to do them simultaneously because if you think about neuroplasticity, there's negative neuroplasticity. And the first time we ever went over this on live was with at Rooted Behavioral Education, Dr. Kostalnik. She's wonderful. If you don't follow her, I would recommend 100% you go follow her right after this ends. But basically we talked about positive and negative neuroplasticity. So neurons that fire together, wire together. So if you think about two neurons, you have one over here and one over here. If you think about I am firing of this one that's telling me whether or not I should be standing up straight and have dizziness or not, and then firing one that's oh my God, I'm dizzy, I'm so anxious. Dizzy is not a bad or incorrect signal. We all have a dizzy threshold, just most people's threshold is high. If you think about it, when you were a kid, you probably spun around in circles and circles and circles, and you could lay down and watch the sky go by, right? That's a normal response, and that's dizzy. So dizziness isn't a bad response, so we need to stop thinking about it oh my God, the whole world is imploding because I'm dizzy. It does feel terrible, and it does feel like it produces a lot of anxiety. But the reason that I think it's important to do VRT and cognitive behavioral therapy or whatever kind of therapy treatment for anxiety you and your therapist are doing is because you need to both decrease the anxiety around movement and do the movement at the same time. Because the job isn't to completely get rid of dizziness, it's to increase the threshold before you feel dizzy. It's the same thing that we do in physical therapy with pain. The objective is to increase the pain threshold. Like if I wanted to run and ran a marathon tomorrow, I would be in pain. It's not because something is wrong, it's just because I did too much too fast. So I recommend doing both at the same time. It will help reduce the anxiety and put you in a safe place to do movement. Do you think doing the balance test is beneficial? I think pretty much all balance tests are beneficial. I love balance tests. I think there are some that are better and more helpful than others. There are some that are more functional. Like I really like the dynamic gait index, the 4-item dynamic gait index for people with vestibular disorders, but I wouldn't give that to a super, super high functioning Olympic athlete. So it's just, yes, I think balance tests are great because if it is at your level, then it is a wonderful way to see your improvement, see progress, measure your measurements accurately in an objective measure. If you have a specific balance test you want to ask about, go for it. Can I travel while having a vestibular disorder? Yes, there are some that you cannot travel with, but if your doctor says that you don't have there's one that there's not recommended. I think it's perilimb fistula. I will go review that right now. But I think, so yeah, that's just because pressure changes affect perilimb fistulas. I'm actually going to review the Vita Travel Strategies article, and I will let you know when that's finished. But yeah, perilimb fistula is the name of it, and that is not recommended to travel in an unpressurized thing. So you can still like car travel and stuff, but it's not recommended that you have big changes in pressures with that. But yes, you can travel with a vestibular disorder. You might want to kind of pack accordingly and maybe ask your doctor for some rescue medications if you want that. It is totally dependent on you, but yes, it's an option. How do I treat MDDs? Again, the DIA protocol is the gold standard. It's DAI if you want to look that up. It can be found, there's a place in Belgium that does it. Someone messaged me the other day. I don't know what it's called, but I know someone does it there. And they do it in New York City. And I'm not sure where else. They do it at Mount Sinai. That's in New York. I know I'm sure they do it elsewhere, but you'd have to ask your doctor. It's a really big room that you need with stripes in it, so it's important to have that. Do you/people with vestibular disorders also have eustachian tube problems, like head and neck pressure? Yeah, a lot of people do have eustachian tube dysfunction. It can also be a pressure problem in your inner ear that makes it feel like you have eustachian tube dysfunction, but it's important that your doctor kind of look at that for you and make that determination. All right, everyone, that is all the questions I have time for today. This will be saved both on YouTube and my Instagram. If you want to scroll Instagram and look at the video at the same time, I would recommend going to my YouTube channel to watch it instead because that's where it is most accessible for that. All right, if you have any other questions, you can always DM me and I will answer them next week. All right, bye guys.